blanket or something? So I did, I put a blanket out for.
Good morning, everyone.
Sharp.
Good morning.
Happy Friday.
Oh, Facebook.
I'd like to call the Health Services Committee meeting to order. First order of business is to approve previous month's committee meeting minutes. Made by Supervisor Frazier, seconded by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried. Okay, Pat, take it away.
Okay, first thing on our agenda, we would like to, request a resolution to ratify the actions of Mr. Sokol in authorizing a contract agreement with, Emily Robson to provide occupational therapy services. And we did that because we needed to get the contract going. We didn't have a meeting just for that one thing.
I thought we approved that on Fridays, didn't we? Last Friday?
We did.
What's that? I think we did that at the board meeting. It was an out-of-committee resolution that we did.
Okay.
Yep.
You don't need it, though?
No, I think we're good.
Okay.
Go ahead, next.
We would also like to request a resolution to accept our 2013 annual report for Warren County Health Services.
That one we did not do.
2014.
14.
I really.
It's been a tough week.
Okay. Well, could we accept
Okay, to get this on the floor, please. Motion made by Supervisor Frazier, seconded by Supervisor McDevitt. Any discussion on this? It's a great report, and I fell asleep 6 times, but all in favor?
But you read it, so that's all.
Opposed? Carried. Okay. Next.
Okay, maybe I can get this one right. We'd like to, authorize a contract with Children's Developmental Group to provide special ed services, for a child that resides in Hague. And we have to do this because there's nobody to see him otherwise.
Okay. Motion made by Supervisor Conover, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, and we would also like to request a resolution to authorize the contract agreement with the New York State Department of Health so that we can continue to sponsor the WIC program for the 5-year period in an amount of, for a total projected amount of $2,507,507,745, and to all further authorize acceptance of funding for the first year of the grant. The grants are renewed annually, and as we talked about earlier in the spring, we can not continue if the funding doesn't stay.
This is still 100%.
100%.
Okay. Okay, motion made by Supervisor Frazier, seconded by Supervisor Conover. Any discussion? All in favor?
Aye.
Opposed?
If anybody would like to see the contract in 75 pages, I decided not to transmit that. But if you would like to see it, there'll be a copy with the county attorney's office, and I did have some communication with Amanda on that. That was kind of a joint decision. Moving on, I'd like to request a resolution to allow Tammy to attend to go to Altoona, Pennsylvania. She's really looking forward to that. Because they are
A wonderful trip.
Sharon.
I'm going on
took
vacation. It was planned last year.
Anyway, the total cost will not exceed $742, and probably won't even be that much. But, and we would also like to request that the travel policy rules be waived because the conference room rate is $89 and the GSA lodging rate is $83.
Okay. Motion made by Supervisor Conover, seconded by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
Taking your family?
This
To
one
Altoona? No, I won't be taking the family.
This one, I'm not sure. I think we're ready to request committee approval to backfill 2 positions. I had some conversation with the administrator and it got signed off on, so I think we're at the point where we can request committee approval to backfill 2 positions that have occurred as a result of resignations. One, a full-time registered nurse, and one, a 20-hour interceding advocate for WIC, and they're both funded positions and reimbursable positions.
Did you need to add anything to this, or?
Pat did review this with me, Mr. Chairman, and these positions were definitely needed as part of her department. It was a very quick review because I knew, well, the one is WIC, so it's fully funded anyway, the infant feeding. And the full-time nurse is part of her services that she provides and gets paid back for by insurance companies, et cetera. So, definitely worthwhile.
Okay. A motion made by Supervisor Frazier, second by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
Thank you. Well, we have no pending items this month. Moving on to information for discussion and review, you'll see in your packet of things, the monthly emergency, preparedness report. It's a little slower than summer, so there's not that much on there. Anybody has any questions? Moving on to status of referrals. That's for Sharon, if you want to comment on that.
We're, right equal to what we were last year for the first, 6 months of 2015. Our numbers are great.
I like those reports.
Moving on to the animal control situation, you'll see attachment number 5 to the rabies program report. We're busy this time of the year with the animal bites. When it rains, it's not very busy because the dogs aren't out there biting. But when it's nice weather, then we get reports of expenditures, revenues.
Attachment number 2 are financials and year-to-date, and, to bring to your attention that we did get an Ebola grant for $38,000, which is now within our budget, but we were also able to bill our first voucher for $16,575 for the fit testing equipment that we need for those, so that's gone out, and, I don't know what kind of turnaround we'll get, how fast that'll, but with Ebola, with the, BT grant too, it's the same thing, we usually get that pretty quick back. Regarding our salaries, this is showing that we're 20,000 over last year. I can tell you 100% of that is all related to 3 retirements. We had one in at the end of April, and we just had 2 in July, and they totaled pretty much $20,000, that, or just $33 difference from last year at this time, and that includes with all the, you know, union raises and everything. So we can account for that, and, going forward, we have one more retirement in August, I believe, and so that will be reflected probably in August or September numbers. Regarding, attachment number 3, you can compare last year to this year. You'll see regarding, expenses were up slightly, and that is primarily due to our, what I labeled it as the preschool program. With preschool, they're waiting for rates, and sometimes the invoices get in quicker than others, so I think it's just a timing of when the invoices got in compared to last year and this year. But overall, fairly consistent. Equipment is down because last year we got cars, and this year, isn't the case, so that's what the big difference is there. Regarding revenues, again, revenues right now, we had a little problem in the month of May, so that's been closed, and I accrued that, so we're in the process of closing June, so those numbers are not reflected, and again, that's why revenues are slightly lower than last year at this time. Otherwise, we're pretty much on track. Like I said, I like to compare our bottom line comparison to where we budgeted to where we are, and we're under where we should be, so that's good right now, by like $200,000.
Any questions or comments?
That's all we have.
Supervisor McDevitt?
May I just go back to the vaccine dogs, I'm looking at the city of Glens Falls, not vaccinated, 11 dogs, that number seems, that's not a good number, seems high. How do you actually determine that a dog is not vaccinated?
If the dog is involved in a bite, then the animal control officer or us, or in the city of Glens Falls, it's the city clerk who checks on the rabies status of the dog, and hopefully at the end of the quarantine period, they do get vaccinated for rabies.
Okay, so.
Not that we want them to bite, but it's a way to get unvaccinated dogs vaccinated.
Yeah, just,
When you take a dog to be vaccinated, it's recorded,
yeah.
so that there's a tracking record, whether it's done at the vets or at our clinic. And if they're not on the list,
Okay.
Well, hopefully,
If there's
next time around, maybe the number will, be improved. Well, is there a way of tracking that number from 11 to the next cycle, so to get some?
No, because they'd be different dogs, they wouldn't be involved. not like we finalize it at the end of the board hearing. But it would be different animals, hopefully different animals, if it's the same dog, right?
Okay, good, thank you.
Okay, anything else for public health? Okay, if not, hang in there tight. Rob York, you're up next with mental health.
Thank you very much,
Have a
guys.
good weekend, ladies. You too.
Have a
Thank
good
you.
one.
Good, how are you?
Fun, yeah?
Having a good summer? Yeah, I went to shoot, lake, yes, last
We can
weekend.
get anything to do another program.
Really
I think he's
get
passing
dark
out
and
as
then
we
it's
speak. How are you?
Good, you?
Good. Enjoy the rest of your summer.
Ah.
Okay. Right there, Ron.
Okay, Rob, whenever you are ready.
Okay, and then I really just have a few quick updates. There's no actionable items today, no resolution requests, but I did want to keep everyone posted on some of these issues. We currently have a vacancy in our deputy director clinical position, and we have posted for that position. We received a good response. Who I feel a good pool of candidates, and we're starting some interviews next week. And so I feel pretty hopeful about refilling that in the near future.
Okay.
In terms of peer services, folks have probably heard me talk about an agency that we're contracting with. It's called People Inc. And they are a group that provide peer mental health support services. And when we say peer, those are individuals who themselves have dealt with mental illnesses, process of recovery from mental illness, serious mental illness. And they have an agency that we contract with them to provide some support services to individuals that are dealing with mental health issues. And some of the services they provide are like mobile support services. They have a warm line where it's a telephone line people can call in 24 hours a day, 7 days a week, and get support. They're really designed to try to help prevent people from having to go to the hospital, going up to the emergency room, managing crises. One of the services that they provide or hope to provide is called crisis respite, and they have a house. They purchased a house on Montcalm Street in Glens Falls, and they want to do overnight respite there. Turns out they ran into an issue with the zoning, and so they're dealing with the zoning issue with the city of Glens Falls currently. So they're not able to provide the overnight respite at this time, but they're still providing the other types of mobile outreach. They have the warm line going, and these are, support services that are well received in the community. People feel comfortable, and they tend to trust somebody who maybe has been down a road that they're dealing with. So I just want to provide that update. I'll keep you posted on what happens with the zoning issue. They may ultimately end up having to find another location to provide those services, but we do feel those are valuable services and that they do help provide an alternative to people who are dealing with a situational crisis where they might otherwise end up in the emergency room or end up with law enforcement involvement, things like that. If they can reach out to a peer support, it's a good alternative.
I wonder if I could just maybe make a comment if I can, Mr. Chairman. I have gotten involved in this issue a little bit, so I'm a little more tuned into kind of the issues, but to basically reaffirm what has been said, there's a tremendous need to identify issues early on in this cycle to prevent major catastrophes from occurring. There's currently a cease and desist order, to my understanding, for the respite services, and that occurred because apparently there was some confusion on the part of this organization or their attorney in terms of getting an approval, before closing on a real estate transaction. So, the respite service opened, did not get, planning board approval, and the city has issued a cease and desist order in an effort to get that issue resolved. So, so hopefully it'll be resolved amicably, that's my hope, and, we'll hopefully, see what happens. I attended Rob's last meeting of Community Services, and their director, who heads up this peer service, spoke, I thought, very effectively, very eloquently about the services he provides in various locations throughout the state of New York, the custody, neighborhood acceptance, and the need for his services. So we'll just see what happens. It's I think we have an element of clear-cut need. At the same time, there is a feeling among some in some communities that they just don't want it in their neighborhood. So that's where we're at, and hopefully it'll be resolved.
I think their interest is at some point moving on and delivering the service, rather than ending up in any sort of protracted process of trying to.
No question, yes.
Okay, one other item, or two other items I have. Next item is we had a resignation from our Community Services Board recently. Dr. Michael Hominick is a psychologist in the community. He has been a long-term Warren County Community Services Board member. He served on the Community Services Board and been involved with the board for over 30 years, serving as chairperson a number of terms. And so I was, at some point I'm going to talk to Mike, but at some point I might be requesting if maybe the committee would consider supporting some sort of recognition. And I'm not sure exactly what that would be, what would be appropriate, a resolution to do a proclamation or something like that.
We typically would do that on a Friday at our monthly board meetings, and Mike served, how many, was it 30 some odd years he was on Community Service Board? It was a lot of years, so
I think his figure was just about 30 years, yeah, a little over 30 years.
So he's paid his dues, done a great job, and be nice if we could recognize him.
Yeah, Rob and I spoke on the phone last week about this, and hopefully for the next month, if Michael can attend, we would like to do that.
And then I just wanted to mention, I don't have a lot of detail on it, is an opportunity for some funding from the Office of Mental Health for county local government units, or my office. There are some new duties that they are requiring in terms of oversight of children's mental health services, intensive services in the community for children with serious emotional disturbance. And so they put out an call for proposals, and just to try to get a read of like how are these offices organized across the state? How are they currently managing the children's services, overseeing them? And with these new duties, what would that mean? And when we looked at it, it looked like we really could use an additional position to oversee the children's services that we're currently overseeing, and the new duties. So we did put in a proposal for a new position. I don't know whether we'll receive, a satisfactory response, and if we do, then I would, at that point, then initiate a process to, create a new position.
Very good.
Should know something within the next month or two, because there are some changes happening with the state in terms of services that come into effect in October, and they're hoping to address this issue, so that counties are prepared to deal with the new duties by October. So.
Rob, are your feelings by next month's committee meeting that you will have filled that vacancy of the deputy director, or?
I believe so.
Okay. Very good. Anything else for Rob? Okay. Thank you, Rob.
Thank you.
And last but not least.
And least.
popular it's become.
Huh?
It's amazing how popular it is.
Oh, it's wonderful. You can't find a place to park, you can go to Spain.
Plus we have the library book fair and the
All today?
Hey Lloyd, it's the first day of track season,
Hi.
so let's make this a quick one.
That's why I'm wearing my jacket, so,
Ready when you are.
Okay, moving right to, action agenda items. The first one is for a new contract with VNA Home Care Options LLC. Purpose of this is as of July 1st, a few days ago, these entities will be paying our Medicaid rates. We won't be billing the state anymore, it'll be funneled through, these agencies. We already have a contract with Fidelis, and we're seeking another contract with VNA. Martin has done all the legwork. He's basically done, well, pretty much everything on this and negotiating the contracts. We're very close to having the final rates in place. And basically there's no cost to this contract. Obviously, this is where they are paying us, so it kind of behooves us to approve it. There may be one other contract we'll be soliciting, and that'll be it. There's only, I think, 3 providers in this whole county who are writing these contracts. Like downstate, you may have 25 people in downstate counties, but up here we're a little more rural, and this is it. We probably already have 1, maybe 2 residents who are coming into play regarding this. If you're currently a resident at Westmount, this doesn't affect you. You can stay fee for service for up to 3 years. But if somebody comes in like today, spends down, gets approved for Medicaid through the county, this is how we're gonna get paid. It's a negotiated rate. Martin negotiated the rate for this contract at a little higher rate than our current Medicaid rate. And how he did that was through the, we're gonna collect the NAMI or the applied income for this insurance agency. And for doing that, he developed a little percentage that we're gonna get extra for doing the collections and doing all the paperwork involved. So, we'll actually come out a little bit ahead of what our current paid Medicaid rate is. And, it looks like a good contract, and obviously, you know, with a sale pending and things, contracts have to be redone by the new company. They're not just a rollover thing, so. We'll start with this. As I said, we're under this as of July 1, but it's taken a while for all these companies to get up and running and getting contracts approved. So I'm looking for your approval on this resolution.
Okay.
I'll bring it to the floor. Then I have a question.
Made by Supervisor Conover, second by Supervisor Frazier. Go ahead, Supervisor Conover.
Thank you, Mr. Chairman. Just, how often do we revisit this, contract?
Uh,
Or these contracts, actually, but.
This one, it's a year contract with Renew. The rate can change based on the benchmark rate of the state of New York, so the rate can move based on what the state does, but we built that into the contract, it'll move accordingly. So, I don't think we'll be revisiting this contract, through the balance of this year, that's for sure.
Okay, all in favor?
Aye.
Opposed? Carried.
Okay, next item, we received a request from basically a state Medicaid department to revalidate our application. Now, this is something they do periodically. I don't think Westmount's probably had this done in, I don't say 5 or 6 years. Basically goes over all the information about the county and Westmount, who the administrator is, you know, your address change, your phone number and all this. And, for the privilege of doing this, you get to pay them $553 application fee to re-up in the Medicaid program, in which you pretty much have to do if you want to be in business. So basically, this is just to authorize check be issued for that amount, and we'll send it in with the proper signatures and get that cleaned up.
Okay, motion made by Supervisor Frazier, second by Supervisor Conover. Any discussion? All in favor?
Aye.
Opposed? Carried.
Okay, the last formal request is for a check for $594 to be submitted for PRI and screen training for Director of Nursing. The PRI is called a Patient Review Instrument. It's how we used to be paid, basically, for our services at the home. but certain agencies still use the PRI assessment tool, you know, it's everything about the resident, this and that. So if we get a referral for somebody, say, out of the state of New York, or, you know, coming from home, or different things, this is the vehicle that we get the information from. We currently only have one person in the building who can complete legally a PRI and a screen, and we would obviously want to have two of everything, so we don't get put in a bind ever. So the director of nursing, Ally's agreed to go to this. I think it's obviously a good investment, and you know, as I said, two people is pretty good to have for, you know, as far as backup. Has to be done by an RN, so that kind of narrows down who's going to be the person to go. So that's what that's involved with.
Okay. Motion made by Supervisor Conover, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay. I don't think we have any pending items of, you know, the nature I'm bringing up today. Staffing levels, we're still looking for a unit manager for Southwest. That's been an ongoing issue, but Ally's made some inroads. We may have a couple people interested, so hopefully we're working on that diligently, because as you know, that is being covered basically by agency personnel now. We still have a few openings LPN-wise and CNA, but I don't think any more than anybody else. I think we've settled down pretty good as far as that goes. Per diems are picking up a lot of the time, especially in the summer now, because this is peak vacation time, let's face it. And the staff is doing, I think, an excellent job, you know, working with nursing administration, keeping the units covered and everything in this, you know, this is the time everybody wants off. Kids are off and everything, so, but we're maintaining our own as far as that goes. We have a few people out on disability. Most of them are pregnancy disability, so it's not, you know, long-term or anything. We have 4 people out currently. One gentleman had a mild stroke. We do expect him back, but it's going to be a little while. The other ones are 2 pregnancies, and another person has, I guess you'd call like fibromyalgia or something like that. It's ongoing aches in her bodies, and we're not sure if she's coming back, but she may be able to come back per diem. We're going to play that one out. We have no one out at this current time on workers' comp. We have some old accounts, some that go back quite a ways, but nobody's currently been working there out on workers' comp or anything of that nature. Just a couple things I wanted to bring up to speed on as far as what's going on. Last time we talked, we had basically quite a few resignations from the people in our office. We've replaced all of those people. I think we did a pretty good job as far as interviewing and training. So the front desk, the biller, the payroll, the scheduler, all these people are new. The senior person in the office has been there 2.5 months. So if we don't follow every rule quite perfectly, it's because we don't know them. But they're doing a great job. I have to thank the other departments that the people who worked at Westmont went to, because their department heads are very cooperative in helping us train, and gave us a lot of leeway and orientation, these new people. So I'd like to just, you know, publicly acknowledge that. That was something that you probably couldn't have done if they went out into the real workplace and never see them again, but this was very good, and I think the transition was very smooth, and you know, they're still just a phone call away if we have something we run into. Betsy is still doing her thing from DPW up north, to do things as she does them, and we're keeping on track with all the financial things through her efforts. Just an item about the ICD-10, which is coming out in October 1st. This is basically an expanded diagnosis project, and they went from like 10,000 diagnoses to 70,000. So it's very elaborate, very fine-tuned, and we're on top of that. Kendra Raymond, our MDS nurse, is going to be in charge of making sure we get all this done properly, and she's gone to training. That's the person you sent down south to an education program before, and so we're on top of that and working with Hudson Headwaters to make sure we get everything done properly. Probably the last item, and I just wanted to share with you for this moment in time, and I handed this out to the head desk there. we've all heard about the 5-star program for nursing homes. It's a, federal program and how you're rated. At this moment in time, your staff over at Westmount is the highest rated home in the area. And I think kudos go to the staff on the units. This has nothing to do with me. I don't take care of anybody. But they have done an excellent job over the almost 2 years and 4 months I've been there. And they've kept everything going, and this is their report card. So they've done an excellent job, and this can change in a heartbeat. We all know that too. But for today, opening day of the track, we're Top Gun. I'm going to take down. If something down there has 4-star anything in the title, we're going to bet on it. 4-star Dave, I don't think it's running anymore, but we'll take it from there. So I just wanted to bring that to the group's attention, that the staff, especially this is basically the CNAs, LPNs, and RNs are really pulling their weight over there and doing an excellent job. Anyone have any other questions of me? That's what I have for the day.
This is a great report. This is
Wonderful.
incredible.
No,
Supervisor
I
McDevitt.
just wanted to commend your organization on that. That is something to really be proud of. It's interesting that you're a 4 out of 5, and Hudson Headwaters is 3 out of 5. Okay. It's interesting also to look at the organizations that are 1 out of 5. Does it get any lower than 1 out of 5, or is that about?
No, 1 is as low as you can get. I mean, but it can take one instance to bring you down a lot. So that's why I say, it's a point in time thing. Some of these things can be 3 years old that they're sitting with, and that's pretty much the case with Westmount to some degree. You had some surveys back in, 11 or 10 or whatever year it was, and those types of surveys are part of your record for 3 years. Once they drop off that negative item, then you move. And so basically in the last 3 years, you've done basically this level. So, but as I say, it can change overnight. Only takes one instance, and it can take a really good home and knock them down. So, some people are living with 2-year-old stuff here, and that's the problem.
Another observation on the report also, the 4 out of 5 column, as opposed to the self-reported column in the report. It's interesting if one looks at that, and an organization will be a 1 out of 5 in terms of a Medicare evaluation, but in terms of self-evaluation is a 4 out of 5. So, I've always kind of questioned that in terms of...
They're going to be changing the self-reporting of the staffing, which is what we kind of do now. They're going to mandate, they're going to basically go for your payroll records. And they're going to have a vehicle to do that, and they'll be bringing that online. Because, you're doing a self-reporting, and it's only good as a clerk doing the self-reporting, I'd say. So if you have the actual payroll records, plus you got to make sure you get, agency in there too. They're not on payroll. A lot of times if you're using a lot of agency, you got to get credit for that time too. You're paying for it, so that'll all be cleaned up. But that's one of the things that they addressed at CMS.
Okay. Paul, we spoke the other day. Did you want to give an update on? Sure.
Chairman Sokol and I spoke, and also, of course, I did make some comments at the board meeting last week regarding the status of the sale of the Westmount facility. As far as the process of the sale, everything is completed except for the DOH approval of the sale, and they do have to issue an approval. We had hoped that the facility would be on the July 23rd meeting, and in fact, when I spoke with you on Friday, I had reason to believe that items could still be added to the agenda and that our facility would in fact get on, hopefully, the agenda for the 23rd. It did not get on the agenda. It is, obviously we were hoping, because the sooner it gets on the agenda, the sooner we can complete the transaction. But having not gotten on the agenda, though, should not be read as any kind of a negative sign. This is a process. These things take time. And so it doesn't surprise me either that they didn't make the agenda. I spoke with Amir Abramchuk, the contact person for Centers, And he was kind enough to actually put me in contact with the consultant they are using that is actually handling the transaction with the DOH. And after speaking with the consultant, here's the points that I picked up on that I wanted to share with you. First of all, from everything I've heard, including from the consultant, Centers is fully committed to purchasing and acquiring Westmount. So the fact that this did not make the agenda should not in any manner be considered as any kind of a problem insofar as Centers is concerned, because they are fully committed and they do want to conclude this transaction. Secondly, the consultant advised me, so this is the consultant speaking, not Amir or Ken Rosenberg or anybody else, but the consultant advised me that Center's application to DOH was in fact fully submitted. And he also added, he says all signs were positive from his perspective. 3, the consultant fully anticipates that the application will be heard in September. 4, Ken Rosenberg has been in the loop and on top of this, and he was okay with the delay until September. He is not, they did, obviously he was involved and his people were involved in discussions of exactly, what was going on and when would it be heard. The only reason it did not get on the agenda is the review process by DOH, as I understand it, was not completed in time. So every reason to believe it will be in September. So at this point, I remain confident that this is still on track. As I said, we had hoped for July 23rd. I don't think anybody ever thought that that was a guarantee. As far as timing of the transaction and sale, certainly 2 months throws us off 2 months. Is there a possibility that we could still close by the end of the year? I would say, based on what has been explained to me as to the process following the meeting, I think it's within the realm of possibility, but I could also see the closing slipping over into next year, January, February timeframe at this point. As I have more information, or if I have any reason to believe to adjust those numbers, I will let you know, but quite frankly, I probably won't know anything more until we get to September at this point. So that's where we are right now. Like I say, we're anxious. I know you're anxious. We'd like to get on our way, but it is a process, and we just need to go through this process. It was interesting, it's I guess not related to this, but it's dealing with bureaucracies and agencies. I saw that AT&T's acquisition of DirecTV has been reviewed by the federal government. It's taken over a year, and from what I see, I guess they're finally going to be looking at their approvals, and so these things just take time. And I think we need to be patient and be confident. I'm confident in Centers from everything I've heard, and particularly when they allow you to talk directly with their consultant, that's encouraging as well.
Supervisor McDevitt?
Yeah, who is their consultant?
Sean, I got the name here. I know the first name was Sean. I'm trying to remember the last name here. I don't know. I don't have it written down on here, but it must be on my other notepad. Oh no, no, I can't read. Sean something. I can't read it on here, but I do have it on my other notepad. I'd be happy to give that to you.
Thank you.
Yes, Travis.
Chris, I think everything you just said is correct. And if there's a delay, it seems to be that the Department of Health is taking some time in evaluating this. And I might add some information that you may or may not be aware of, but in their home in Moravia, New York, Northwood home, they, on their last survey, had 16 deficiencies, one of which was an IJ. So that's going to cause the Department of Health some concern. In Corning, New York, they had their most recent survey indicated 30 deficiencies. And you can go through and you can look at all these things. I've never seen anything close to 30. And I've also had some discussions with the people down, the ombudsman in that area and such, and she's beside herself as far as the problems that are going on at Corning. So this might explain some of the reasons for the delay in the Department of Health coming forward with a recommendation for a transfer. I'm not sure. but I just thought I'd add this. I'm also anxious to see this get in front of the committee, because I have, some documentation that I'd like to submit to the committee once I see that application, in writing. So, yeah, this is gonna be an ongoing process but the sooner we can get it all completed, the better for everybody. I would like to add a little bit. First of all, I'd like to say that I think Lloyd was just a little modest in taking credit, or not taking credit, for this 4-star rating. I think it has a lot to do with the administrator, and I want to thank him for that. I also went on Medicare, the Nursing Home Compare site this morning, and printed out the ratings of the other facilities in the area, which are within 35 miles or so. And it was interesting to note, I just want to point out a couple of them. You'll see there's 4 columns there. The first one's the overall rating. The second is the New York Health Inspection. The next 2 are self-reported ratings, and the last one is just the distance from Queensbury Center. So Westmount's the closest. It was rated 4 out of 5 stars overall. There is no other facility on that list of 11 that is rated 4 out of 5 stars. So the only ones that were anywhere close to that were Fort Hudson and the Wesley, which were 3 out of 5 stars. In the New York Health Inspection, we got 3 out of 5 stars on the last inspection, and the only other one that got 3 out of 5 stars in the area was Fort Hudson. It's interesting to note we have Washington Center here. Their overall rating being 1 out of 5 stars. Their New York Health Inspection, 1 out of 5 stars. But interesting to note, their self-reported quality measure was 4 out of 5 stars. When Mr. Rosenberg spoke in front of us, he mentioned how he gives bonuses to his people for reporting on the quality issues there. Exception was taken by Mr. Beatty at that time, saying that might not be a very wise thing to do, and I think that this is why Medicaid, Medicare rather, has looked into that issue over the last few years and decided that indeed they will weight the self-reported columns less, and they will also start to monitor, actually audit some of the numbers coming in on staffing and such to see whether or not they actually are real. So and that's what's going on here, and again, I want to congratulate Mr. Cody, but Westmount in general, for what they've done, and I hope that I can come in front of you in another year, and whether it's being run by the county and whether it's being run by Mr. Rosenberg, I hope that we can, extend the same congratulations. Thank you.
Thank you, Mr. Wyatt. Anything else for the committee? Okay, motion to adjourn, made by Supervisor Conover, second by Supervisor Frazier, all in favor? Aye. Opposed? Carried. Thank you.